Nothing here is delicate. Nothing's
intentionally.
Not even me.
Yeah, so intentionally, right?
Yeah. All right. You ready to go?
Yeah, let's do it.
All right. Welcome back to Local Talent. Today in studio, Harlon Pickett. Mr. Pickett, you want to give everybody the elevator pitch, who you are, what you do, and who you do it to?
Yeah, my name is Harlon Pickett. I have actually three major things I got going on right now. I have my own insurance brokerage, HP Insurance Broker. Harlon Pickett HP Insurance Broker. You can find us at hpinsurancebroker.com. Also, I create customized health plans and health solutions, as it were. We combine a lot of the great benefits that people would want in a health plan. And so we really sell that through our broker channels. So kind of give you an idea what some of those benefits look like. You have your protection from ER visits, hospitalization and such, so that you don't go broke on that. You can also have any type of virtual visit you want, whether that is virtual direct primary care, urgent care, mental wellness, and behavioral health. We also have in-person visits that you can have for that with just a $25 copay. Prescription drug coverage. Our prescription drug plan is very different. While we have over 200 medications that are only $1, we also have access right on the platform that you would use to find your medications too. You can even get your medications internationally.
Wow. And
then you can get those medications through discounts from the manufacturer. Okay. And that's all right there on the platform. So you can find out if you qualify just right there. We also offer a very unique benefit, and that is zero cost ground or air ambulance.
Okay.
Those can be very expensive.
Yep. Speaking from experience, I've been in an ambulance twice in a couple of years.
Yeah. Very expensive Uber ride right there. Yeah, and then if you get that helicopter ride, you would be much better off taking a 2-hour tour of the Grand Canyon, because you could do that for a whole lot less money than you could for, say, a 15-minute helicopter ride after you've had an accident. And what we really see on that side of it is how many of those claims are rejected by your big insurance companies, saying that they were not medically necessary.
Yeah. Well, and then so speaking from experience, I had a similar situation actually. I walked into a local hospital and I was like, I think I dislocated my shoulder. Turns out it was a lot more severe. It was a motorcycle wreck. And so they said, well, we're going to take you to BAMC or SAMC. And so I said, my wife's right out front. I said, I could just get a ride and we can go, and they said, no, we got to take it by ambulance. So I was like, I mean, I'm okay, guys. I walked in here. I feel like I could walk out. You know what I mean? But they were very adamant about me going in the ambulance. And then so sure enough, I get a bill for it. And then it was zero was covered by insurance. Right. And I was like, what the hell? That was like $1,000. you know? And it was about a 15-minute ride. So
right. How do you get your insurance now?
I have a plan through Humana. So I have an insurance plan through Humana. And I have a local doctor I see in Cibolo, Sean Dittman.
Okay, so your plan is actually a group plan.
I think so.
Yeah, because Humana doesn't actually offer plans on the individual. They don't offer plans on the marketplace.
Right. So it's through the business. It's,
okay. So if you go out to the marketplace,
what's funny is like I've got this card.
But you don't know what you got.
I don't. I really don't. So you could tell me what's on there better than I could.
Oh yeah, that's a good card right there. That'll get you some good benefits. This is definitely a group plan.
It's not cheap.
No. Yeah. Now I can imagine it's not cheap. But yeah, this is a group plan. Whereas most folks that are self-employed and don't have enough to have a group, go through the marketplace, and you go out to the marketplace and
is that tied in with Obamacare?
Right.
Is that what that means, marketplace?
Right. Yeah. You go to the marketplace.
You're going to have to really walk me through some of this.
That's okay. But the name of that website is healthcare.gov.
Okay.
You cannot buy healthcare on healthcare.gov. You can get an insurance plan, but you cannot buy healthcare.
Right.
It's intentionally named that way. Once again, it is all part of that brainwashing. It's all part of that process to get you to think that you must have this to get this.
Yeah. Before you got into healthcare, what were you doing?
Before that, I worked in corporate America. Worked for Houston Lighting and Power, which doesn't exist anymore.
So that's pretty dramatic change from electricity to health. I mean, is there some kind of bridge there that I'm not seeing?
Yeah. Well, I worked there for 19 years, and like many of the folks in my department at that time, they decided they didn't need my services anymore. I was actually in environmental health and safety at that time. So what I really did is go out and do groundwater testing, dirt sampling, emergency response to acid spills or oil spills, PCB remediation. Wow. Well, that kind of developed into another thing that was probably my most exciting job, and that is I was a right-of-way inspector via helicopter.
Oh, wow. Check that out.
Yeah, for a few years.
Were you a pilot?
I was not a pilot.
Okay.
I just got to ride around in a helicopter with the doors off.
Yeah.
With this giant big zoom lens camera.
Wow.
And old laptop computers that if you hit somebody with, you'd have killed them dead because, they were giant brick things back then. And so that's what we did is about 250 days a year we were in the air.
Wow.
It was a great job. It was a lot of fun. Even going into the environmental, I made a lot of friends, still lifelong friends that I made in those jobs, but getting laid off was really the best thing that ever happened, because that gave me the opportunity, what we're going to talk about today, that gave me the opportunity to become an entrepreneur. During all my career of working for the light company, we also competed in barbecue cook-offs.
Nice. Okay.
So we didn't go.
What's your meat of choice?
What's that?
What's your meat of choice?
Well, brisket, of course. Come on, Texas, baby. So when my wife decided she didn't want to go back to work, well, what are you going to do? Well, if you cook, then I have a lot of people in the pharmaceutical industry and the DME industry that have all these doctors as clients, and they buy lunch for them all the time. So, you fast forward then to whenever I got laid off. I got my last day was Friday. On Monday, we could do twice as many jobs as we could do before.
Okay.
Literally, I just stepped right in. We doubled our business over the weekend.
Wow.
We took more jobs for them.
Sure.
We let people know. Really, I kind of knew the writing was on the wall.
Yeah, sure.
We didn't know it was it was going to happen, but we kind of figured it was.
You got a backup plan. Hey, if this happens, which we think it's going to, we could do this.
Exactly.
Okay.
And they weren't keeping it too much of a secret per se, but they weren't really giving you a time. This is when it would happen. So all of a sudden, when this guy got here, which, he was the hatchet man, when he came in, okay, today's the day, guys. Yeah. All right. But if you had stayed gone, they were paying you 1 year's salary and 1 year insurance. Well, so I lose that if I come back.
Yeah. Why would he take that deal?
Zero chance I'm coming back. So that's the financial side. I had actually got an extra year of salary side of that.
Gotcha.
So that helped us move into that transition to where we were working. And so the catering business, it just took off, man. You had mentioned earlier before we got started about you had seen me or had seen on Shankar Poncelet's live Facebook feed, him being on my radio show.
Right.
And I've known Shankar for a lot of years. And for a lot of those years, he wasn't my client and I wasn't his.
Sure.
The time had to be right for both of those things. And now both himself and his company are clients of mine. And we've been using his services as our web designer and social media platform. And they do so many things behind the scenes for us. But it wasn't the right time until it was the right time. But there had to be that relationship.
Sure. Let's talk about marketing for your business for a quick second. How do you get your name out there?
Shankx.com.
Hold on now. Are you are you working with Eagle Care or are you working with Shanks?
Well, you got to think about this now. So
who's writing your checks?
Maybe I'll get a discount here on it. So, no, it's very interesting. The number way.
Do they handle your marketing?
They do. They really do.
Okay.
They really are my marketing group.
And you just turn that over to them?
Really?
Okay.
Really. Now, historically, what have I done? What most people do: join Chamber of Commerce, go out and network on everything that you can do. I'm not saying I reached my limit on that, but I was at everything.
Yeah.
People would even say, I don't even know how you can be at all of these different things. I would literally drive to Houston, do a radio show, drive back, and be at a chamber event or be at something else.
My God.
Okay. Those obviously long days, but I would be at something almost every day.
Do you feel like you have any competition?
Of course, there is competition. There's no doubt there is, but the answer is no. I don't feel like I have any competition. And I know that's there's absolutely competition out there, but there's so many people that need help. There's not competition out there. Once again, I'm going to fill a certain need. I'm going to help a lot of people.
Do people feel that you're intimidating because you speak so knowledgeably about your product, or because you're just not afraid to say something?
Yes.
Right on.
Yeah, it's interesting because I've had someone from my industry saying, man, you love this a whole lot more than me.
Love is a strong word.
Yeah, I don't think that that's the case. I feel like I'm doing my client a disservice
if I don't know.
If I don't know more
if you know
about it.
just enough to sell something, that makes you useless.
Well, you're a sales guy.
Right.
You're not an industry expert.
Right.
And my goal is to be an industry expert.
Mm-hmm. So you mentioned your show. You have a power hour, a health power hour.
Health and Wealth Power Hour. Yep.
Okay. And it's a radio show. How would I listen to it?
Yeah. First of all, it's live every Thursday out of Houston, Texas. That's at KSEV Radio 700. If you were not in Houston and didn't dial in there, there's actually an app on your phone at both the Google and Apple. You can go to KSEV and download that app, or you can go to KSEVradio.com and listen to it live. And all of the recordings, we have over 60 episodes, been doing this well over a year now, and they're all as podcasts now, of course, available on there too. And
so what is the show about? It's obviously health and wellness, but how does walk me through an episode? Is there a typical episode?
There really isn't.
No?
That's what's kind of cool about it is I'd asked you before, tell me what doesn't involve your health or wealth.
I struggle to answer that question, by the way, anybody listening. Did you have an expectation of what you wanted your business to be, how big you wanted it to be, what kind of revenue you wanted? Did you just say, you know what, I just want to be happy?
Well, it's interesting. So let's talk about two different phases of that. Let's talk about whenever I first stepped into it, say in 2008 full-time, to when I stepped away from it in 2010 and went to the restaurants, to whenever I was back in it in 2012. My expectation in 2008 was a whole lot different than it was after the restaurants. And the reason for that, quite honestly, is I was just an insurance agent.
Okay, in 2008?
I was just an insurance agent. Okay, and I learned a lot about the industry there. That's really whenever I started working with the guys over at FESA and started working in that federal space. Whereas whenever I came out in 2012 back into it, the whole world was my oyster, as it were. And I was looking at things differently. Obamacare had been recently passed. And
were you looking at things differently because of the environment of the world, or just because of your experience in the restaurant, those three restaurants? I mean, why did you have a shift in perspective?
Well, I think a lot of it had to do with experience too, because remember, I had worked in corporate America. I had gone entrepreneur, had, two or three, I guess you can almost say, failures at this point. Things that just didn't work out the way my long-term dream and vision was.
What would you say you have applied the most from your 9-to-5 corporate job to your business?
I have a lot of folks that work for me now. None of them are treated like we were treated in our corporate jobs. All of them have freedom. All of them have input. Primarily, I'm going to say that. All of them have input. Even the folks that my brokers that sell our product, we are 100% transparent on everything we do. And not just that, but I want you to tell me what you like and what you dislike.
Right.
We talked about Shane Carr's team. One of the things they're doing for us right now is they're going out to 10 random people, whether they're clients or brokers or even just some small business owner that we've talked to and had some relationship in some way. And they're getting the facts on what they like or dislike about us, what they like or dislike about our website, any kind of interaction with us whatsoever. Because
data's king, man. I'm a big data nerd.
But you've got to know, right? You've got to know.
Data doesn't lie. It is what it is.
My mantra, and everyone in my company has started hearing this, is it can always be better. If that wasn't the case, there would have been an iPhone 1 and there would have never been another one afterwards, right?
Absolutely.
At some point in time, they could have just quit because they finally got this is it.
Can't get any better than that.
That's exactly right. You talked about competition earlier. You have competition. So somebody else comes out with something like, damn, they got ahead of us, man. We got to come after them, right?
Whether customers want to believe it or not, the best thing for a customer is competition.
That's right. And that's what's wrong with the healthcare industry is there's no competition. Once again, if you're not shopping for prices, they have no reason to make the prices transparent or to make the service is more accessible and better.
If they got nowhere else to go, why do they care about making it better? What kind of relationships do you have with doctors in your industry, right? Most people don't understand that doctors, while they are doctors, they also are business owners. So how does the insurance side of things and the way they prescribe, and I know I'm asking a lot of you, but you know what I'm saying? So how convoluted can that be? You know what I mean? How drastic does a doctor have to get in order to one, make a right business decision versus the right health decision for the patient?
Many of these doctors have positions within that pharmaceutical company. They're on a board, or they're on a one of the doctors that helps do the test groups.
Is that public information? Mm-hmm. I mean, by law, does it have to be? Like, so could you find out if your doctor was on a board that...
For a pharmaceutical company?
Yeah.
Mm-hmm.
Okay.
Yeah.
You could totally sell why you'd want a doctor on the board for your pharmaceutical company because they have insight, you know. I mean, you know, let's just say that, you know, there's nothing nefarious going on here. You know, you could sell it both ways. You know what I mean? But still, how impactful is a doctor's decision based on a patient's insurance?
Very impactful.
See, it's
very. And the reason I say that is because the contract with many of these insurance companies, it actually determines how long you can spend with a patient. You give them that card, and now they know how long they have to spend with you. DPC doctors are more interested in curing you,
mm-hmm.
not treating you. More people are on more meds than they ever have been before.
Yeah, there's no money in the cure. There's the money's in the treatment.
Right, the money's in the treatment.
There's an argument there for cancer.
Well,
let me get my tinfoil hat real quick before we go any further.
No. I hear what you're saying, and I think there's a lot of people that say, okay, well, there's some limits to that, right?
Sure.
And cancer being one of those. Okay. But we also know that in many cases, the treatment for cancer is worse than the cancer itself.
Yeah, it kills everything.
Yeah, we've seen that happen. I have an uncle that happened to. I mean, did they get the cancer? Yeah, but they pretty much destroyed all his organs.
Yeah.
Okay. He ended up in hospice either way.
And I'm sure on the doctor's win versus losses, that was a win because they got the cancer.
They got the cancer, right. So if you actually look at the outcome, right, the outcome was a win. We got it.
Mm-hmm. Okay? Killed the patient, but
right.
We got it.
You ask about doctors. We partner with a lot of doctors. We do a lot of direct contracting with doctors.
What does that mean? You partner with doctors?
So if a doctor is a direct primary care, or let me give you a great example. Right here in San Antonio, there is a concierge doctor service called We Care.
Okay.
If you get on their program, the We Care program, it's a 5-doctor concierge service that will come to your home or office to provide all your services, including blood draws, x-rays, a whole myriad of different services that you can have done.
They can do x-rays in your house now?
Yeah.
Man, that's awesome.
And so they don't even have a brick and mortar. They all work out of these SUVs that are equipped with all of their cool stuff.
Wow.
You ask how we partner with doctors. We get together with doctors. We talk about and make sure everyone's goals are the same.
Sure.
Make sure everyone believes in the same philosophy of taking care of people and really giving them true access. That's what we do.
Okay.
Is we sit down with that doctor. We get to learn about them. They get to learn about us. We make sure we're all on the same page. And then we start recommending them. We build a plan specifically for them. Mm-hmm. And then they can start offering that plan to their members and also use it as a way to attract new members. So many doctors got into this profession to help people. Mm-hmm. And insurance companies and pharmaceutical companies have changed everything so dramatically that they've lost focus of that patient-first relationship. And so they're done. They're just done. COVID just really pushed it out there even further, and so many of them are just done, and they're going back to their roots and back to why they got into medicine to begin with. This is amazing statistic here for you, but since Obamacare came into existence at hospitals, the growth on the administration side, remember how you were talking about coding earlier?
Yep.
The growth on the administration side, 1,700%. 1,700% growth in employment side on hospitals. On the caregiver side, 3%.
So the business is growing in a rate that the paperwork needs more attention than the caregivers. That's something that should really stand out.
And why do the prices keep going up, right?
Yeah, because you have more staff. You have more. I mean, you got to pay for this red tape.
Right.
You know what I mean? We're going to do the lightning round. So pick a color. I'm going to grab that deck and shuffle them.
Red.
The red deck is Would You Rather. Now, these are off-the-wall questions, and just remember, as I'm asking these to you, you pick the deck. So, would you rather fart in an elevator full of strangers or burp loudly while giving an important presentation at work?
I'm going with the elevator full of strangers. Absolutely.
Would you rather have your face printed on money or your own small town named in your honor?
I think I'd take the small town. I don't need my face on money, man.
Would you rather have your jaws wired shut for a month, drinking only out of a straw, or wear an eye patch for a year?
I'll take the eye patch.
Yeah. I gotta have my steak.
Yeah, gotta have my steak, man.
Would you rather eat peanut butter and jelly or grilled cheese sandwiches every day?
I'm gonna go with the grilled cheese.
Grilled cheese?
Yeah.
That's fair.
Yeah.
Peanut butter, it's great at first, and then the jelly's always stay. Anyway, would you rather wear adult diapers the rest of your life or never wear underwear again?
I think I'm going with commando, baby. Yeah, I think I'm going full commando on that one.
What would you say is the number one thing that you wish that you would have known before starting this business?
I really think that I started the networking side later than I should have.
Okay.
It was probably around
networking, like going to the chambers of commerce.
Exactly.
True
networking, getting out there and getting known.
Okay. What would you say the biggest mistake you've made in insurance has been?
I think the biggest mistake I made was putting all my eggs in one basket too many times. Not being prepared for industry changes, as I told you,
2008,
not being prepared for things beyond my control, being too narrow in my focus.
What's the best advice you ever received in business?
Don't give up. Don't ever give up. Okay, and I think
that's certainly true for you.
I've had so many times when it had been very easy just to go back and get a job.
Sure. Yep.
Just go get a job, man.
And it's so tempting too because it's what you know.
Right.
You know what I mean? Even if it's not even in the same field, it's just like, I know how to play this game.
Right.
You know
I know. Just show up on time, do your job, go to the house, man. Just do that. But don't give up.
Are you a student of healthcare abroad? Do you have an example that you can point to that you think, man, they're just really doing it right?
There are countries. Luxembourg is one of those that does a good job. And there's other ones. Some of the Netherlands areas, they do a good job. The problem is they don't have near the number of people that we do.
It's not apple to apple.
It really isn't. And that's why people try to compare that and say, oh, well, look at what Canada's got going on. Yes. Yeah. And then you look at places like the Texas Free Market Surgery Center. There's a number of those across the state of Texas. You look at those and you see that the number one client that they have are from countries like the UK and Canada and other places where they have socialized medicine.
I'll be damned.
Why do you think that is?
Well, socialized medicine, you got long waits.
Got a long wait.
You can't get in to see get the procedure done.
Right. I need
if
this
they
hip
even
replaced.
let you have it done.
Right. I need this hip replaced.
Yeah.
It's not quite bad enough to get it replaced yet. Suck it up.
And plus, there's a lot of people in front of you.
Right.
Where do you project your business in the next 15 years?
Our goal: 1 million clients. 1 million.
In 15 years.
In 15 years. Before then, but our goal is 1 million clients. And when I say that, a client is anyone we help.
Okay. Yeah. So you might have a client that has 100 employees.
Well, then I'm actually that client. I'm going to count all of those people as people we helped.
That's what I'm saying.
Right. But my other thing is a client is someone that I've given advice to, someone that looks to us as the expert.
Sure.
So I may tell you, Jason, hey, man, that Humana plan you've got, that's rocking. You just stay with that. Okay. Stay with it as long as they'll let you have it.
Sure.
Okay. And then I may talk to you some more about some other things that you've got going on.
That's a win.
And it's a win. You're a client. You trust us to give you some good advice.
Absolutely.
Whether you buy anything from us or not, I consider you one of our clients now.
Okay.
And at some point in time, you may actually become one. As far as now you're a customer, not just a client.
Right.
Okay. Or you may just refer people to me. Either way, that's a win.
What would you say is the biggest myth when it comes to health insurance.
You don't have to have health insurance to have quality health care. We talked about that earlier. You do not have to have health insurance to have access to health care. I want to say that one more time for the back row. You do not have to have health insurance to get quality health care. And in many cases, you're better off if you do not have health insurance.
What makes healthcare so complicated? If you could generalize it.
The answer is that's the way they want it to be.
Who's they?
The government.
The government makes healthcare complicated.
Right. Who put all these regulations into place? Who made the system the way it is? It's all anytime the government gets involved in something, let's look at the tax code. Why is it so difficult to pay your taxes, right? Shouldn't it just be some flat amount, period, and that's it? Remember, all of these people were against Obamacare.
Yeah.
Hospitals were against Obamacare. Insurance companies were against Obamacare. Pharmaceutical companies were against Obamacare. All of them were. Certain promises were made by the government to each one of those entities behind closed doors for certain things. And all of a sudden, they slowly but surely started backing Obamacare. Almost 20 years later, and there's just now some talk about some control over the price of medications and pharmaceuticals. Yeah. What kind of control is that? I mean, it's not happening the same way. Physician-owned hospitals are gone. Okay. We're not talking about ERs. We're talking about gone. It's because the big hospital systems were promised by the Obama administration that those physician-owned hospitals would not be allowed to be in network. I mean, all this is public record.
Sure,
you just got to go look at these things and see what happened to get these guys on board. No one wanted it.
Right.
And then all of a sudden they all wanted it.
Right.
If you look and you say, okay, a company like United Healthcare, why wouldn't they have wanted it? Well, because they didn't want to have plans that they couldn't underwrite. Because that's what Obamacare is, right? There's no underwriting. You just are guaranteed to get it.
Right.
So they said, man, we don't want that. We want to be able to decide who's going to be on our plan. We need to be able to underwrite this stuff.
Sure.
Because we're going to lose money. It's going to be terrible. It's going to be a bloodbath for us. When Obamacare was passed, the stock price for United Healthcare was around $22, and now it's about $250. I wonder if they've done okay.
Yeah.
Through Obamacare. Another thing that I believe is a huge, huge conflict, and we talked about doctors earlier, United Healthcare is now the largest employer of doctors and surgeons in the country.
That doesn't even make sense.
Does to them.
Why would a doctor be an employee of United Healthcare, of an insurance company?
Because they've bought all these practices.
But if your business is to sell insurance, why would you own a hospital? Why would you own a practice?
Why would you not?
It seems like a big conflict of interest.
Yes. Yes, it is. Why they've been allowed to do it by the government? Yeah. Answer your own question. Okay. But yes, absolutely. Why would they be allowed to continue to buy up? Because that's also gets rid of your competition, right?
Yeah. Yeah. If you own all of the damn positions,
But you also get to dictate now who that physician gets to see. And if you're a small employer looking to buy an insurance plan, but most of the doctors in your area are taking United Healthcare, but they're not taking these other guys.
Right.
You may not even know why.
Right.
Well, there's a reason why, because those doctors there at all that hospital work for United Healthcare. It should be criminal, but once again, the government has allowed it.
I mean, by definition, wouldn't that be a monopoly?
You would think it would, right? But
monopolies are bad.
Monopolies are bad. So we've been told, right? United Healthcare's answer right now, and it's United Health Group, I believe, is what their big mother company is. But their answer right now is just buy it. Just buy it up. I mean, that's what they're doing. There's an organization so United Healthcare, what they didn't have is they didn't have their own independent agents. Okay. They always sold through broker channels. So they went out, and one of the largest groups of independent agents in the country, they went out and just bought that too. And so now they have these independent agents, and these independent agents sell things other than United Healthcare. So now when these agents go out and sell Humana, United Healthcare is making money too.
Amazing. I mean, from a business angle, yeah, it's smart business, but
it's crazy though, right?
Again, competition is a good thing, not, So, okay. So the single worst thing for, healthcare is government.
It's government. It really is.
What could people do to bring down the cost of their insurance?
Shop, care. I mean, you really want to shop for your care. I mean, when I say shop and care, there's two parts of that. Care about what the cost is. Stop spending other people's money because it really is yours. Yeah, I understand that you're one of those blessed people that work for a big company and you only have a $500 deductible.
Sure.
And, but I just go and
everything's covered.
Right, everything's covered. But why haven't you got a raise in 3 years?
And so I was going to tie that back into my own personal experiences is that after I had my back surgery, my rates go up.
Yep.
My rates had been pretty much the same because we hardly ever use the insurance. Mm-hmm. You know what I mean? And then I had some pretty big expenditures in one year, and then my rates have went up like 35-40%.
Sure. So the definition of insurance, I probably should have started with this, right? The definition of insurance is sharing the risk.
Okay.
That is the true definition of insurance, is sharing the risk.
Okay.
Okay. But if you're now more of a risk, I've got to charge you more. You have a lady who gets a hysterectomy. Mm-hmm. She's never going to have that surgery again.
But your rates are never going to be let low again.
That's right. Because she had that, they have to recoup that somehow, even though they know that actually that is not even a risk anymore.
Right.
There's just zero chance that's a risk. Mm-hmm. But now she's had surgery. So now she's a risk to have another surgery. Well, yeah, but not that one, but maybe something else. Maybe there's a complication that could arise from that. Mm-hmm. That's valid, right? Sure. But the risk actually went up just a little bit, so our rates must also increase. Now, the difference. So let's talk about the difference in what we do. So with Eagle Care, because we're not 100% insurance, we do some other methodology in there too, including what's called a healthshare. We don't look at things the same way. And in fact, our rates over the last few years have gone down from where they started at. Because
in this market, that's impressive.
Yeah. So you look at this and you say, okay, well, you know what? These things didn't cost us as much as we thought they would. Because of our direct contracting and our negotiating with these hospitals and facilities, we didn't spend as much as we thought. Okay. Let's pass that on. Let's lower that rate down because this helps everybody, right?
Right.
And then remember
if you're paying less today than you were a year ago for your health insurance, tell me that's not going to register when it comes time to renew.
Because our health share is not a deductible, is not insurance. We can't use that term. Technically, we can't use. We call it an initial unshareable amount. Okay. Well, let's say that you had a $5,000. That's the maximum you can have, by the way, is a $5,000. So you're going to have your back surgery. Mm-hmm. You have your back surgery, and then you're into the next year. So you had your back surgery in November. Now you're into January. Mm-hmm. All right, here goes my 5,000 again, right? Absolutely not. That never resets for that incident until you're 12 months medically cleared. Even if that stretches out to a 2, 3, 4, 5 year event. Mm-hmm. So think of someone, especially someone like in treatment for cancer.
Chronic.
They may never get released. They may die before they actually get released, but maybe they fought the good fight for 5, 6, 7 years. They never had to pay that $5,000 again.
So what determines that IUA?
You choose. So what rate do you want to pay? The $1,000, the $2,500, or $5,000?
Because it changes the monthly.
It changes the monthly. That's exactly right. There, in my opinion, I don't see much reason to have the $5,000 because it's not a whole lot different to be the $2,500. Now, here's another thing.
So real quick, is this called insurance?
No.
What is this called then?
It's a health share, medical health share.
A health share is what this is called. Mm-hmm. So there's no in-out network things you got to worry about.
There's no in-out of network you got to worry about.
There's no book to see if your doctor is or isn't available in this thing.
That's exactly right. And then we're going to negotiate on your behalf. You decide you want to get your gallbladder removed. They went through all the testing. Yep, it's got to get done. You decide you want to go to use the Baptist Health System, and I'm going to go to their surgery center over off Tupperwine. Mm-hmm. Okay, great. We're going to call up the Baptist Health System over on Tupperwine. We're going to talk to them and let them know that Jason is going to be in there to get this done. Yep, they've got record of you. Okay, Dr. Jones has already sent your information over there. We're going to negotiate the best price for you and for us, and we're going to pay for it before you ever go.
Wow.
So when you show up You're not going to have to sit at the little intake thing waiting for them to say, well, what kind of cards you going to use today, Jason, to get all that done. Before you leave, you don't have to have the lady with the little machine sitting there next to you saying, well, I'm sorry, this card's not working. If you got another one, we can't let you go until we get this taken care of.
Usually they won't let you in.
Right.
Yeah, and that's funny, actually, because like the last few times that I've had any kind of care, they run your card for a certain amount, and then they say after it was all said and done, oh, you know what? It was a little bit more than we anticipated. How frustrating is that?
Yeah. Let me full disclosure and tell you, you're going to find some doctors and some facilities that don't want to participate.
Okay. What would keep them from participating?
They're really not ready. They
don't understand the process yet.
They're so involved in this insurance world that they don't know how to get out. They don't know what. Because cash is still king. What we're really offering them is cash.
Right. Yeah.
You still find doctors right now that won't do it.
Right.
They won't do cash. Well, wait a second. But what if it's more? How much does it cost, Doc?
Right. Why would it be more?
I don't know. And they don't know. They don't know because everything runs through insurance. And if insurance doesn't tell them how much it costs, they don't know. We had a doctor, one of my wife's doctors. She went to see her and she goes, we're going to use this healthshare. She goes, no, we don't do that. Like, well, what do you mean? You don't take cash? The doctor sits there and goes, well, no, we don't, because it might be more than what we charged you. Well, how could it possibly be more than what you charged me? You don't know what it takes for me to come in and do a visit and do my blood work? She has no idea what it cost. She doesn't know because what insurance are you using? That determines how much it costs, whatever our contract allows.
What a frustrating business to be in. I've had several businesses in my life, and I have had firm control over what I was charging a client. You know what I mean? Sometimes it was hit or miss. Sometimes I was way over. Sometimes I was way under, but I made the choice.
Yeah.
You know what I mean? I couldn't imagine having a business where I had no idea what my service was going to cost. How old is this health share idea?
40 years.
So how is it that health insurance seems to overshadow health share?
Health insurance is guaranteed. Okay. When I say guaranteed, they're guaranteed to pay your claim if it's medically necessary and they decide to, and
meets all the
right. Okay. It's guaranteed. A health share, it's just it's kind of like a handshake to a certain degree.
Okay.
We're going to take care of each other.
Mm-hmm.
Okay. That's really what it is. And so to some people, that's just not. So you can decide not to cover me. Well, technically I can decide not to pay your claim. Well, why would I do that? Because you didn't meet the member guidelines. You got shot while robbing a liquor store. We don't pay claims for people that got shot robbing a liquor store. Healthcare
seems really to be the only thing where, well, yeah, you said that earlier. It's the one thing that people just don't care what it costs. I don't want to say don't care. They've become accustomed to not knowing, not interested.
That's right.
Not.
Well, they don't think you can know. We've been convinced that you can't know.
Yeah.
That it's some magical, strange thing that goes on behind this curtain, that there's no way until all the things are done that we can come up with this magical thing. And then you get this explanation of benefits, this EOB. I know you've got them before. You got a ton of them after your back thing. Mm-hmm. That is written in some foreign language that you have no idea.
How does this get fixed? Can it be fixed?
Yeah, but it's got to be the buyer. The only one that can fix it's the buyer. And the buyer is everyone that's listening right now, and everyone that person then talks to, whether it's an employer looking for his folks' plan, whether it's the individual looking for themselves something. The people that are buying the insurance just keep exasperating the problem. It just keeps getting worse and worse and worse. You've got to make that conscious choice to shop for healthcare just like you do for everything else.
Healthcare, not health insurance.
That's what I said. Yeah. Healthcare.
Well, yeah, no. I was just making sure that, like you said, to people in the back. For anybody that wants, well, and in your case here, we'll have to to make an exception. So, parting words of wisdom for any entrepreneur that's looking that may be on the fence, wanting to be an entrepreneur. What kind of advice would you give them? And also, what kind of parting words would you give anybody for your industry, for healthcare, for the patients?
Yeah, so let's first of all start with anyone that is going to look at it being an entrepreneur. Mm-hmm. My first words of wisdom is just do it, man. I mean, I've talked to so many people that are still with a big company. You know, USAA, I've talked with so many people, especially with USAA, that just can't make that jump.
It's a secure, that's quote unquote security, right?
They pay you just, once again, they pay you just enough and have just a good enough benefits that you can't make that jump. Now, that being said, have a plan. Don't just decide you're going to be an entrepreneur.
Free fall.
Leave and say, well, I'm going to go to a few network meetings and see what strikes my fancy. No, take a couple of weeks off from your job, go out to a few networking things and see if something strikes your fancy. And I'm kind of saying that tongue in cheek, but no, what do you love to do? Find that thing you love to do. Oh, well, what I really love to do is work for myself. Are you sure? If you've never done it, are you sure? You may be the worst boss you've ever had.
Yeah.
You really might be. And in a couple of different ways. You may be way too hard on yourself, or you may be way too easy on yourself.
Way too relaxed.
And
too many attaboys.
Yeah. And there's the other part of it is, can you actually work alone? Can you do it? Do you have the willpower? Do you have the gumption, as it were? Do you have the discipline to be an entrepreneur? Is it a great idea, but not a great idea for you? Because that's the case. But I really think most people can do it if they find that thing they truly love to do. And that's what sets it apart. Is it can't be a grind, man. It just can't. You got to love what you're doing.
And then so the parting words for insurance, somebody who's looking for healthcare. Yeah.
So about 80% of the people in this country are good fits for an alternative type option.
80%. That's a hell of a market there.
Right. About 80% of the folks in the country are good candidates for a healthshare, for direct primary care, for those type options, non-insurance options. The other 20% have severe chronic conditions or health things, or they're getting over something, or maybe they're not medically cleared for certain things. And so they're not a good candidate for that.
Sure.
Because non-insurance products are going to have some exclusions on pre-existing, even though like our plan will take anybody. No matter what, we don't exclude you because of pre-existing, but we're not going to provide coverage for that.
Sure.
Okay. Unless you're 24 months out of it. So if you've been cleared for 24 months, and it happens again.
Cancer?
Yeah. So if you're over 2 years out of cancer,
2 years out of cancer,
you're good to go. Okay. As long as you're not in treatment. Okay. So, and we could talk about the definition of treatment with you individually, but that's the way it is. We also don't consider things like controlled blood pressure, so if you're taking medication for high blood pressure, for high cholesterol, or you have, whether it's pill or insulin controlled diabetes, those are not considered pre-existing conditions. Okay. For hospitalization. So let's say that you got on our plan, everything was good with your diabetes, and then all of a sudden,
like under control.
It's under control.
Okay.
I mean, we've got proof. Here it is. It's under control. 6 months into it, man, something just went crazy and wonky with you. You ended up having to have a toe amputated. We got you.
Wow.
Because it just happened. It wasn't like you were out of control. Something, body chemistry or something weird happened to you. We got it. Maybe your doctor put you, and this happens, maybe your doctor put you on another medication that did not react well with what you were on.
Okay.
And all of a sudden, now you got in this situation. Okay. That's not a pre-existing.
Okay.
Okay. Once again, that's why about 80% of people are a good fit for us, but others are simply not.
Sure.
That's why we talk to each individual. Are you ready to make the jump? Well, there's a couple of reasons why you wouldn't. Number one, you're not a good candidate because of health.
Right.
Number two, you're simply not a good candidate because you're not ready to make the change. You're not ready to really join the revolution, look at things differently, be an educated consumer, because that's what you really are, is you're an educated consumer. People spend hours and hours in front of their computer in other ways looking and shopping for cars and TVs and washing machines and dryers and all these other things, and they spend virtually no time shopping for healthcare.
Do you have a typical demographic of customer, like age, sex, gender is still a thing, right? I can say that. Do you have a bubble that your typical patient fits into?
Yeah, really, where we see the biggest, I think, impact right now are people in, say, 30 to 50 years old. And the reason for that is they kind of grew up in the health insurance world to a certain degree, but they're feeling the pain of it, typically at jobs where the cost keeps going up or they can't afford to put their family on a plan anymore. A lot of them are a little more open-minded, more entrepreneurial in thought. And entrepreneurs in general are great fits for our plan and our just whole demeanor on everything that we look at. And it's because they are more open-minded.
Yeah.
An entrepreneur says, man, I get it. This is great. Why should I pay all my money toward Humana or Aetna or United? Why should I give them all my money for something I never use?
Where can people, again, you said at the beginning, but where can people find you? How can they get a hold of you? How can they get in touch with you?
Yeah, well, first of all, if you wanted to talk about something other than Eagle Care on the health insurance, life insurance, disability, long-term care, Medicare, all of that side, then you can go to hpinsurancebroker.com. That's hpinsurancebroker.com. Or if you want to look at any of the Eagle Care products on that side, that is eaglecarehealth.com, eaglecarehealth.com. And you can, of course, go check me out on Facebook, Harlon Pickett, Facebook. Also, of course, both those companies also have Facebook and LinkedIn. And then you can check out my radio show every Thursday at ksevradio.com, 1 to 2 p.m. every Thursday, Health and Wealth Power Hour.
Do you actually go to Houston to do that show?
I did for a while. Then I finally spent a lot of money and bought a setup to do it remotely.
Nice.
So I've done it. I know this sounds crazy. I've done it live from Fort Worth. I've done it live from my house. I've done it live from Maui, Hawaii. So I can pretty much go anywhere and do it remotely now. So I've done it remotely at a bunch of different places. The furthest away, of course, being Maui. But that was pretty cool.
How cool is that? Didn't say you did your Houston show in Maui.
Right. And of course, I'm trying to remember what time it was. It's like 8 o'clock in the morning or something there. So I'm waking up early and having some coffee and saying, okay, we're live to you from Maui today. So
that's awesome. Harlon, I appreciate you coming in today. I know you're a busy guy. Did I not ask you something? Is there something that you'd like to, that I didn't touch on at all? I tried to get a good range of questions for you.
You know, one thing I do want to mention about, and I talked about my struggle with this years ago, and that is one of the things you have to watch out for as an entrepreneur is that work-life balance, that family work-life balance, and making sure that you don't give that up.
Yeah.
Part of the reason why you became an entrepreneur was freedom, right? I mean, most of you out there that are thinking about becoming entrepreneurs, it's the freedom, is to get away from the man, work my own hours. Do what I want. Well,
but then you don't.
Right. Then you focus so much on that business. And I'm not saying that focusing on that business is not part of what you got to do. You got to work hard. You got to get there. It's not an overnight success in most cases. Sometimes it is, but it's not in most cases. But you can't just leave your family behind. You can't have no life except for that, because you'll end up regretting it, or you'll end up finally just throwing up your hands. I have known many people that just threw up their hands and went back to work. Yeah. Went back to a real job, as people like to say it, because they couldn't balance that. They just couldn't do it.
And personally, I've experienced some of that myself. Burnout. Burning the candle at both ends it's all good and well. It's fun to post the grinding pictures of the office and all black with just the one light on at your desk. Yeah, I get it, and I've done it, and I've been there, and I think, like I said earlier, I think you have to when you're starting a business. I think you've got to. You have to be there for your customer. You have to be, Johnny on the spot, and everything, but that shouldn't be the end goal. Right. You've got to, even during that time, you still got to have some self-care. Sure. And part of that self-care is not losing that. Don't get so concentrated on those relationships with clients that you lose that relationship with your family. Yeah. Okay. And I really got there. I mean, it took me a while to get that relationship back with my son. Yeah. I mean, he was very angry for moving, period. And then as he told me years later, and man, just broke my heart. He said, I didn't just lose all my friends, I lost my dad. Yeah. And that's what he told me. That's tough. That's hard to hear, I'd imagine. Oh my gosh. I was just devastated. And he didn't tell me that then. He told me that after the fact. He's like, that was the worst part, is I lost all my friends and I lost my dad. Yeah. And I was like, I'm trying to tear up now. Yeah. Said it just was devastating to me. And it took a long time to get that back. Listen, we can talk about all of this shit. You're going to have to, anybody listening, you're going to have to experience some of this. You just got to keep this in your mind. You got to understand that this is happening. And, I have a little section here that I like to talk about support. And, that usually comes from your immediate family, whether it's, your mom and dad, like my nephew, or if it is your spouse or your children, or, there's this whole support system that is not just one way. It's not them supporting you, it's y'all supporting each other, and if you can't make time for them, it's going to bite you in the ass.
The other thing to remember is when you're an entrepreneur, especially if you don't have any in your family, and I didn't have entrepreneurs in my family. My dad still to this day probably thinks I'm nuts. I mean, remember, he worked 38 years at the same company, retired when he was 57 years old because he had worked all those years.
All those companies are gone though.
Right. But the fact of the matter is he didn't get it.
Yeah.
I mean, still was like, I can't. And there's no doubt there was lots of years of struggles. And every time something happened, he'd be like, see, this is why you don't do that. You should have went and got you a job, or, this kind of mentality.
Right.
But they always supported us. No doubt about it. Sometimes even financially supported us to help us get through times.
Sure.
But the fact of the matter is if you don't have that person in your family, there's a lot of groups out there that support entrepreneurs. There's a lot of mentors out there. Build those relationships. Mentorship is absolutely imperative. And there's so many of them out there that will help you. People want you to succeed.
Yes. And, also the mentors come they don't come announcing that they are your mentor. Right. You can find them at a chamber of commerce accident.
That's right.
You can find them by somebody you do business with, mentorship. I've had lots of mentors that they didn't know they were my mentor.
No, you're right. And I exactly. My mentors I typically found when I started networking.
Yeah.
That was another thing. That's why I say networking changed my whole dynamic, because finding those people that had been in the business, that had been through struggles, that could relate to what I was saying, those type things are what really changed my business in many different ways. It helped me with the networking thing, but it also helped me in people being mentors to me that never even realized that they were, just by sharing those conversations and sharing their expenses and making me realize that I wasn't the only one that had dealt with this.
Yes.
That I wasn't alone.
Yes.
That I was having the same issues that somebody else had or was having right now. And so then we worked through it together. They don't have to be in your industry.
Right.
They don't have to be related in any way to your industry.
The nuts and bolts of business are roughly going to be the same.
That's exactly right.
And so, the guy that's running the tropical smoothie down the road versus a car care business on the other side of the street,
Right.
They all have the same. This is what's funny about business owners in general is they usually get into a business because they are good at a craft. That's how I got into business. You know what I mean? I was good. I was very skilled at what I did. And, didn't like the work environment that I was at. Went out on my own, usually, there's some pay involved in there, but
Right.
freedom, like you said earlier, was, at the end of the day, the true driver behind all of that. But I didn't know shit about business. Pay taxes? That's something that a CPA handles, right? I mean, now I got to get a sales tax ID. What is that for? What I don't understand. I got to do this every week now, and this government stir sheets. There's so many moving parts. And then depending on the business type, hell, shit, you might even get a loan. You might need some type of financing or something, and then you got to talk about depreciation and equipment and things like this. There's a lot that can go into a business. There's also a lot of things that I don't say a lot of businesses, but there's a lot of opportunities where you don't need such a formal education, but business education in some aspect, I think, will go a long way.
Well, one of the biggest things that we were missing, both my wife and I, whenever we started our catering business, is understanding how our business runs.
Right.
We had always been in some kind of corporate job.
Right.
And so while we were having a great time and we were making money, we weren't probably doing the right things with that money the way we should have. Sure. And some of the things, income taxes and sales tax and things come back and bit us in the butt some. We were okay, but at the same time, it was hard lessons to learn. And we were like, oh man, I wish I would have known. Right.
Right. Yeah.
Because you didn't know.
Right. You don't know what you know.
That's right. And it was one of those things where we thought, man, we were just killing it. Look at all this money we're making. Oh, hell, 40% of this is the government.
Yeah. What do you mean this isn't all mine? It's in my account. I'll say this before we leave here, I was pretty lucky because I live pretty moderately, you know what I mean? I don't finance vacations. I don't, I don't have to have gold teeth, things like this. Right. So, whenever I first started out in business, I started making some good money, and I was like, oh, wow, this is nice. You know what I mean? And then at some point it even kind of got to be addicting to watch the numbers grow in your account. You know what I mean? It's like, well, I don't even go buy a cheeseburger because then that's going to take away from this, you know what I mean? But I got really lucky in that, I was audited for 2008, 9, and 10 all at once. And, around that time frame, a lot of people maybe don't remember that the economy sucked
Yes.
then, from the housing and credit
Right.
and all these other things. And so, I was really lucky because I didn't not spend frivolously, I had a decent savings, and in the end that all went to IRS, but it was, it would have been something that could have been real ugly. You know what I mean? For me, like I said, I never buy new vehicles. I don't buy expensive clothes. So my cost of living didn't really change much. It was nice to breathe a little, you see, you get some money and, you work an hour, but anyway. But so whenever, the business side of things started to come to fruition, I guess you would say, or come in my face, like, hey, look, you've been putting this off long enough. You didn't even know you were putting it off, but there's other people that need to get paid for your hard work as well. So, yeah, I was really fortunate that it shook out the way it did. I didn't think it was very fortunate at the time, but anyway.
Well, once again, it's you just got to learn those lessons. And so, man, hey, I really do appreciate. It's interesting being on the other side of the microphone.
Yeah. I was going to say, you got, this is my first, So, Harlan, I really appreciate you coming in. I had a good time. I learned a lot.
Yeah. Hey, I had a great time too, man. You're a good host. Keep it up. I think that folks can learn a lot from these talks with you. And so I really appreciate you having me on. I hope that, the folks that listened at least picked up a nugget somewhere here or there.
I'm such a horrible self-promoter. You know what I mean? So we have a website, we have a blog, we're on YouTube, we're on Spotify, Apple, iTunes, we're everywhere. But there's plenty of places to engage in conversation about any of these episodes. And I do a horrible job. I need to, hey, engage. If you got something you want to say, comment, whatever, Facebook, we're everywhere. So if there's something that you disagree with or something you want to say thanks, or if you want to tell me that my shirt's dumb, just let us know.